Thanks for giving me this opportunity to address you today, and thanks to Annette for warming you up, so I don't have to cover some of the stuff that she's already covered. It's similar to that in that I'm calling it a dentist with special skills as well. As Annette said, there are programs in the UK, dentists with special interests. They have certificates at the end. There are things that they do. Thanks to Critty from our department. It's always good, if you want it to look good, surround yourself with people who are good. And it's been pretty easy for me because since I've been here, I've been with Dental Health Services now for 7 years, and I've been involved in the selection of majority of the people in our department, which is good because it makes me look good, but it also means I have to work to stay in the team and on top of the team because people are Critty, I'm very proud to work with, and they would show me up if I didn't stay on top. So let's move on to that. So first of all, let's start with a question. Has anybody heard of a mini residency?
You mean a little house?
Good question. Okay, that's more than I probably thought. So, what is a mini residency? Well, yep. So, basically, it's a short-term. This is my definition of it: a short-term, hands-on clinical training experience in a specific learning environment. And oral surgery, you'll see why we needed an oral surgery. And then I'm just going to read this because this is all important. This is in achieving our goals. It's to improve access to specialist services. So I'm not just talking about oral surgery, I'm talking about other specialist services as well. Supporting general practices, particularly for rural communities and priority groups. And also to support training and development of clinicians as well as support staff in expanding their scope of practice and delivering new models of care. So a little bit of background here. We spoke about that already. And patients, if you hop in a car and you go up to Echuca, that's a holiday. If you come down to have a tooth out, that is not a road trip. So what we would like to do is to be able to, and people coming down, obviously oral surgery, they'll come down, they'll have a consult, and then they're going to come down again to have a procedure done. And if we could expedite those kind of things, and particularly considering that majority of the referrals that we get, and we get an increasing number of referrals every year, we're a finite department. There's no more space at the Royal Dental Hospital. There are 6 surgeries, there are 3 theatres. We hopefully will be able to open up a 4th theatre, but that's what we have. There's a finite number of people in the department, so we're FTE of just over 6, and we're getting more and more people every year. So you guys send us more people. We don't have the luxury of turning down referrals. So other people might say, no, we can't do that. We can only do so many of these procedures per year. We can't do that. If people need surgery, they need surgery. So basically what we need to do is upskill people locally to do stuff that they're actually capable of. And I think what happens is that you're competent but not confident. And we need to get back to those things. So same as what Annette was saying now. You guys are able to do it and just need a bit of support. We've had this opportunity, so this is the light bulb story, where you need to do something, that's what we have to do. Ideas always come out of necessity. So we have been running a program in oral surgery department twice a year, just a 1-week program. We give lectures, we give hands-on clinical experience for 3 days, and then another day of lectures and working on animal models. And just looking around, there are people, aspirants, other people who have done the course with us. They have then gone on to work in primary care and other places. Martin Hall has worked well with us as well. We have clinicians who've moved on to North Richmond, and it really reduces the referrals to us, which helps us a lot, and also obviously helps the local people and also helps the clinicians in the area. So a little bit about our department. We've got a handful of surgeons and part-time, unfortunately. It's always about deciding how best you're going to spend your money. So do we have just a very small number of surgeons working really hard and just doing as much as they can in the time that they have available. Now, chances are that's not going to happen because, fortunately for surgeons, it's pretty lucrative in private practice, and so it is very unlikely that anyone would work full-time at the Royal Dental Hospital. So we've got people who are keen on teaching, people who are keen on sharing knowledge, and they come along, they act as consultants. We've got registrars, 4 of them, who are, at any one time, we've got 4 part-time registrars. They are in a training program, and they will be with us for 6 months before rotating to another unit. We've also got 2 dentists who are trained in oral surgery, have a special interest in oral surgery, and these are our workhorses as well as the resident. This year we only have 1 resident in less, I'm looking at Deb, in less lean times. We have had the luxury of having 3 residents, and it's been very fruitful. And so by having residents go out and do things in other community centres afterwards, it obviously saves us a lot of referrals. And the mini residency is actually based on that principle. So a resident would be with us for 1 year, and next year we interview another one. Every year we get a new resident. And these mini residencies would be, I'll tell you about how the program's going to run. We also have undergraduate students, I see Manaka here, and it's this whole training and teaching. We are a training and teaching environment, and we believe we do that well. Our dental assistants are a big part of that, and they do that well as well. So dental assistants rotate through the hospital. They come up to oral surgery. They go into a day surgery unit. Some people enjoy it, some people don't. If you enjoy it, you go with it. And they are actually excellent in, because we've got such a high turnover, we've got these obviously resident but also registrars coming through, and the dental assistants have a very major role in showing people how to do things. So the proposed program would be to have 2 clinicians for a period of 3 months doing work under supervision in our unit, and at the end of that period we would get probably 2 of their dental assistants, their local dental assistants, to come down and do some training with our DAs in setting up surgical setups and things like that. Obviously more time would be useful, but there's always there are costs involved in these kind of things. We would like to run 3 courses per year, which means six clinicians would be going out and being very, very useful in their community, to the people and to us. We would do similar to what we do for our dental alveolar training courses. We would do lectures, we would do hands-on training, we would do, they would obviously learn how better to manage, how better to assess people, how better to manage the situations, and I'm going to go over that at the end as well. This is the 2 very important words there: risk averse and quality care. And when we've got people like Credit in our department, that is excellent. Hurdles. This is the difficult bit. So funding, obviously there is a finite bucket. There is only so much. It would be great if we had more. And again, I said to you, it's about deciding how best are we going to spend that money. So if that's all that we have, what are we going to do with it? Do we, as I said, just get a couple of people to do this? The problem with that is you catch as much fish as you can, In 2 years' time, if you've got the same number of people, you will not be catching any more fish. We are getting more and more referrals. We would like to service more of the eligible community. We know that we're only servicing, I'm not up to date with stats, but it was 14%, which is really not great. And if we're going to provide that care, we need to train other people to go out and do this work. And there would obviously be, it means that we'll be less productive in our unit because we're spending time showing other people how to do things. Having said that, it's great to see what Annette showed you, that it actually wasn't, it was cost equal in that. And this is how our department runs at the moment. We've got a few specialists who are overseeing the work done by other people. I gesticulate a lot, you've probably noticed. And so we watch what other people are doing. So, and I don't think that it's going to be good to just have a few people. I think it's better to get people in and train them. Yes, the octopus model. That reminds you. 1 second. So Melbourne Zoo was looking for 2 mongooses. I'm from South Africa, obviously, and they were looking for, is it 2 mongooses, 2 mongoose, 2 mongai? So apparently the letter went out that it was, please send us a female mongoose, P.S., please send us a male. as well. So it's all about the wording. And the difficulties here, so we've done some homework as well. I'm not going to show it all to you. We've done some heat maps. Where do our referrals come from? Obviously, if people are coming down from really, really far away, it would be good to send a clinician or have a clinician from there come down, do some training, go back and be able to provide care there. That is great. The other thing is that we look at numbers. So there might be places that are much closer to us that are sending a really big number of stuff to us. And it would be great to have one of their clinicians being able to be upskilled. And so the problem is that the difficulty to attend would mean that they need to come down here. We've looked at options, possibility of having someone come down every Monday, and these things, we've really looked into it and it's not going to work. The way that we see it would work is to have someone with us for 3 months and then go back. It does make it difficult because I've got to talk fast because I've got to take my twins to a birthday party this afternoon, and you guys have all got things to do. You've got families, you've got other things. So unfortunately, it's not going to be available to everyone just because of the nature of the job that it is. And I'm very sorry about that because we like to share and we'd like you all to get involved. So it's going to be difficult. Having said that, we look at our registrars, and these are guys who've done medicine, they've done dentistry, they've done surgical training, they also have families and things. They are not earning great salaries, and by the time they finish, before they're a surgeon now, if you graduate from high school, you will spend 18 years before you're a maxillofacial surgeon. So that is quite an investment. So I'm thinking the 3 months is probably not so bad. What is it going to do for you? It's going to make you competent in coming to good diagnoses, in doing the right investigations, in managing surgery and doing it well, and not just being competent, but being confident. So I want for you to be excited about it. And we get like that, and it's sometimes people are a little bit, because I know that I do this, I like to explain things to patients, and I'm placing an implant, and you're doing this, and you're doing this, and you show them things, and afterwards you think, even sometimes you section a tooth, and you take out the 3 roots, and you kind of want to say, there's my root, you know, and Mrs. Jones does not want to see this, but, you know, it's like, you think, you know, indirectly, I mean, we're artists, and can you imagine someone paints something, and then they don't show anybody? It's like, no, our painters are not showing anybody. It's like, no, look what I've done. I've got this tooth out. So anyway, so we want for you guys to be happy and to be competent in doing these things and to be confident, and also obviously to be able to make decisions. Who does get sent to the dental hospital and who doesn't? And then can you manage this? Should you be sending it down? At what? How urgent should you be sending that? Recognize which cases are for you, which cases are not, and then also be able to manage complications, and what you can't manage, refer appropriately. And I think we've done that well on some of the courses that we've done. What I do believe is that there are going to be positive outcomes for everyone involved. For the patients, it's going to be excellent because they will get local access to the places that they want to for the treatment that they need. They're going to get a choice about whether they come down to us or just have it done locally, which would be good. Obviously reduced wait times, and then for the people who really do need to see us, they would get in sooner. So priority care for the people who need us. This is a picture of Michelle. She was one of our residents as well, and these are people who have developed better skills in oral surgery. They are happy with what they do, and this is an important thing as well, and I've put it on the next slide because it's not just for the guys who participate in the course, it's also for us. It's improving that relationship between the communities and us. So as I said, we're a very small department, busy but small, and we want contact going backwards and forwards so that the communication is open. For us, and that's our department as well as the communities, increased capacity, reduction in the wait lists, reduction in referrals. This all is quite obvious. And so I have another question for you. Do you perceive the need? Do you think we need this? You don't have to. Yes, I'm happy. Thank you. So.
Thank you, Warren.
I'm happy, but I'm not done yet. Thank you. Thank you. So, what we need to do, moving forwards, mini residency, that's not the end. The mini residency is not the end. There's more. And the point is that you go back there, and this is why it has to be 3 months and not 2 weeks, is that you will have questions, you will want to know stuff. And so it's about having ongoing stuff. And so teledentistry is something that we're hoping to develop as well. And that would give us the opportunity to have ongoing learning. You can contact us back. We can do things. It's going to help us. It's also going to help the patients, obviously. And this is something that Deb did at another meeting. She said, or it wasn't a meeting, but she said, if there's anybody who knows how we can do this, let us know. And so I'm saying to you, if you can think of a solution that is going to work better, don't just tell your partner at 11 o'clock at night. Tell someone who's going to do something about it. And that's like what Critty does. Don't just do the peer review. Do something with the outcome. Have an outcome. Don't just talk about it. Thanks.